You got two? Yeah, honey, you're so lucky.
I do have PCOS. Hi everybody. I just wanted to come back and give a quick update because the last month has been full of so much stuff that has gone on. And there was a few things that happened that I definitely wanted to touch bases on because when I was searching the internet for key information about a few things, I wasn't getting a lot of resources. So I just wanted to add to the few videos that I was able to find, just in case others are looking for the same information that I was. So if you've seen any of my other videos, you know that I have been using the gonal F injections in hopes of getting pregnant. So what happened this past cycle is the first part, everything, I started the injections as usual. I did the trigger shot, and I kind of knew that something was a little bit off after I did the trigger because I still temp, and my temps were not rising like they normally would after ovulation, and when they did, it wasn't really that much higher, even though I know that I had did the trigger shot and that ovulation, is almost, they say, guaranteed to happen. At least that's what my RE says. So I even called and I was like, hey, I'm temping. I have done the trigger a few days ago and I'm not noticing a shift the way that I normally would when I have successful ovulation. Can you guys check? Because I wanted them to check my progesterone levels. And the nurse was like, well, we don't typically check for progesterone because ovulation is pretty much guaranteed with the trigger. So just stop temping because it's not reliable. Well, of course, I didn't stop temping because I just can't. So I continue to temp, and then I've had some failed Clomid cycles, and with those I did a trigger shot, and then I've been using the trigger shot with these gonal F cycles too. So usually exactly 14 days after I trigger, I start. And this is going to be TMI. If you're not here for that, then just go ahead and click off because it's going to get a little bit graphic. So on cycle day, on 11 or 10 DPO, I started spotting, and I'm like, that's weird because normally when I trigger, like I said, the 14th day, it's like, and it doesn't start spotting or anything. It's like, bam, it's here, full force. That's been how it's been every single time that I trigger. And so I was like, this is really odd that I just triggered, 11 days ago, which put me at, 10 DPO, and I'm spotting. So it kind of picked up, as the night went on, and by the following morning, it was kind of a flow, not too heavy, but I definitely needed a sanitary napkin. It was more than spotting, but not as heavy as my normal menstrual cycle is. So I decided to take a first response, which I test my trigger out, and my trigger, I had tested it out a few days prior to that. About 8 DPO, the trigger was out of my system, 8 or 9. So I got a faint positive on a first response. And like I said, I had been taking the first response before that and they were negative. So I was like, what in the world is going on? So I called the doctor and they had me to go in to do blood work. And I was still bleeding at the time. They did an exam and they said that I had a lot of follicles on the left side and the right side, but that they didn't see anything in my uterus, which was to be expected, but to just wait on my HCG results in the afternoon. So when I got home, they called me back and they were like, your HCG is only at 4. And I'm like, how is it only at 4? And I have this positive, test. So I'm just like, whatever. So of course I keep testing. I'm still bleeding, and I'm testing as the day goes on. As the days go on, the tests are getting darker and darker and darker. And so the plan was, when I first talked to the RE, he said, you're probably having a chemical. So he goes, what we're going to do is, I want you to come back in on Monday. By then, your numbers will probably be down to 0. And then we'll go ahead and start you with start your injections again on Monday. So I was like, okay. But over the weekend, when the test kept getting darker and darker and darker, I'm like, okay, my HCG is not going down like we planned. It's obviously going up. So I went to they have a women's urgent care area, whatever, because I wanted them to check my progesterone, because I already knew something was up with my progesterone when my temps weren't the way that they should have been. So I'm still bleeding. It's been days, it's been probably 4 days at this point. I'm still bleeding. So I went back and actually it hadn't been 4 days. It would have been 2 days, because when I went back and I had the little place, the OB emergency clinic, they did my labs again. My HCG was only at 10. Mind you, I've even got positive digitals. The digitals are positive. I'm like, my HCG is at 10 with my digitals being positive? This is ridiculous. My first responses are dark. I don't understand what's going on. So they're like, well, maybe you just caught it really, really early. So Monday, I still went back in. Of course, they did another scan. They didn't see anything. They saw multiple follicles on the right, multiple follicles on the left. And he said that the reason why I had follicle growth on both sides is because the HCG makes your ovaries really happy. And so eventually the, follicles will dissolve on their own and it'll be fine. So we did another HCG test, and this time when it came back, it was at 30. So my HCG went from 4 to 10 to 30. And then he was like, okay, come back in 2 days and we'll do it again. So I went back in 2 days and it was at 234, I think, or whatever. And so at that point, that's when they're like, okay, you're pregnant, congratulations, da 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 da. And I had stopped bleeding by the time my HCG was at 236. And one of the doctors had started me on progesterone suppository. So I think that's what stopped the bleeding. So anyway, I was like, okay, they told me that before I did the last one where it was 236 or 234, if your HCG rises again, then we'll go ahead and schedule your first OB appointment for when, you see the baby's heartbeat and stuff. You'll be 6 weeks and 4 days on September the 13th. So that's when we're going to schedule your appointment. So I was like, okay. So when it came back at 234 or 236, whatever, that's when they scheduled the September 13th appointment. And like I said, I would have been 6 weeks and 4 days at that time. So some time passed, a couple days, no more bleeding. I started to be a little bit crampy, but reading the forms and stuff, and I have other kids, and I've been crampy before, so I wasn't really worried. But then I kind of started getting a little more, crampy than than what I classified as normal. So I went back to the doctor. He did another scan. All of the follicles had gone down except for one. There was still one fairly nice size follicle, and he was like, that's probably the corpus luteum. It's a corpus luteum cyst. It'll go away on its own. And so I said, okay. So a few days after that, I was really like uncomfortable, like really super uncomfortable. So I went back to that urgent OB, and or no, before I went back to the urgent OB, they had me run my HCG levels again, and it was only at 669, which at that point it should have been like over 2,000. So, but he was telling me at first, he's like, well, I don't, they were doubling normally at first, so I don't think that you have an ectopic, and, you know, I think everything is fine. So then when the HCG came back at only 669, they had me to, they kind of were just like, that's not what we wanted to see, which, you know, I already knew that. So a few days later, I went into the urgent care because it was a weekend. So I went to the OB urgent care because I was having this pain, and they did an ultrasound, and because before they were like, we can't see any sac, we can't see anything, we don't see nothing in the uterus, we don't see nothing in the tubes. So the ER doctor did the ultrasound, and she's like, she was looking kind of weird, and I'm like, why are you looking like that? Is everything okay? What are you seeing? And she's like, well, I found the gestational sac. And I go, okay. And she's like, and it looks like it's in the ovary. And she goes, but I have to be really careful because we know that this happens, but it's very rare. It's the rarest form of ectopic pregnancy. So I want to make sure that the diagnosis is correct. So she had a whole bunch of people coming in and looking and looking and looking. And they determined that, well, first they were like, we need to prep you for surgery, and we're going to have to remove the ovary. And I'm like, whoa, I don't want to have my ovary removed because, of course, it's on my right side, which is my good side because my left tube is blocked. If you haven't seen any of my other videos, in addition to having PCOS, I also have my tubes tied, and then I had them reversed in 2014, December of 2014. And my left tube blocked again, so I only have, you know, my right side, my right tube that's open. And so if you take my right ovary, I'm pretty much out of luck, you know. So I was like, I don't want to have surgery, da da da. So they did another HCG test, and this had been a couple of days from the last one, and it was like 6 something, like right around the same number. So it hadn't moved in a few days. So I knew that something was clearly wrong. After they did everything, they decided that the methotrexate would be, you know, a good, you know, treatment for the ectopic. So I did the 2 injections on each side, you know, of your bottom. And I went back at 3 days, and my ACG had dropped from 660 something to 540. And then I went back on day 7, and it had dropped all the way to 201. And then now today is day 14 after the injection, and my ACG is at 9. So I'm guessing within the next few days I'll be at 0. And so I thought it was a good time to go ahead and do the video. I wanted to do the videos like in the meantime, but it was just so much going on, and I just couldn't. I couldn't. But I wanted to come on and talk about that bleeding that I had in the beginning, because if I wasn't someone who constantly peed on a stick, I would have thought that I was on my period. you know, I would have never ever even known that I was pregnant, because it wasn't it wasn't spotting. People say, well, I mean, I can't even call this an implantation bleed, because the baby wasn't even in my uterus. But so I don't know what kind of bleed you would call that. But you know, I hear people say, you know, when I would be looking stuff up, you can't, you know, if it has to be a spot, or it has to be, it's not red, or it's not this, or it's not that. Or if I would have followed all of those things, I would have never taken a test, and more than likely I would have thought that I had my cycle, and my tube, or my ovary rather, would have ruptured, or you know, I would have really been in for it, because I would have just not even known at all that I was pregnant. So I don't know if this has anything to do with, I don't even know how you get pregnant on your ovary. Like, what? I don't even understand. A part of me is like, you know, did the trigger shot not cause the follicle to come out all the way? Or did the follicle come out but just kind of linger and not get swept into the tube? Like what happened? I have no idea. And I've already gone through every single emotion that you can possibly go through, because I mean, we've been trying for so long, and it was just like, yay, finally, you know, success. And then it's like, what, really? You know, so I know I've been reading about what, you know, you're supposed to wait 3 months or whatever. My RE said that when you get your cycle, where you can start trying again. There's no reason to wait 3 months. You know, just start taking your folic acid and, you know, try again. So we're just gonna start trying again. I do have PCOS, so, oh, the other thing is the metformin. I know that, you know, metformin is supposed to be really good when you have PCOS, but I don't take it because it's always giving me super, super severe GI upset. And I watched another video. Oh, I cannot remember the lady's name, but I was watching her videos, and she suggested, if I remember your name, I promise I'm gonna do another video and thank you. She said to take the metformin, both tablets, at night before you go to bed. And since I started doing that, I haven't had very much GI upset. So the past couple of weeks, I have, you know, been able to sustain taking the metformin consistently. I'm not at the 2,000 milligrams that they want me to be at, but I am at 1,000. I'm taking both tablets at night. Sometimes I'll get froggy and take 500, you know, with my breakfast or something like that, but I have to not be going anywhere or doing anything, because I don't know, you know, I don't know what the effects are going to be later on. So and some days that works just fine, I guess, depending on what I ate, and sometimes it doesn't. But if, you know, you're struggling with taking the metformin, you know, I'm glad that that blogger mentioned taking both of them at night, because it has really changed things around for me. And I'm hoping that, you know, I'll start to maybe get some regularity with my cycles, because I do get cycles every month, or, you know, 5 or 6 weeks or so, but I just don't ovulate with them. And I'm kind of up in the air on if I should just try the metformin and not do the injections. But then a part of me is like, but I know that worked, and maybe that this is just a fluke. Like, I don't know. I don't know. I don't really know what to think, but now I'm just waiting on my cycle to start, because 3 days after the methotrexate, I did bleed for 3 days, but it wasn't, I know that wasn't my cycle. So I'm just waiting on that. I know now that my ACG is down to 9, it should probably I'm guessing, you know, within 3 or 4 more days, it'll be down to 0, and I'll expect a cycle here within the next 2 weeks, 2.5 weeks. So I know this is a pretty long video. It's been a lot that has gone on. If anybody else has gone through an ectopic pregnancy, I know that it's truly devastating, and I hurt for you just like I hurt for me, because I was just in a world of upset for a while here. You know, we're just gonna pick up the pieces and keep on trying, and hopefully, you know, our next, you know, go around is successful. But I wanted to, like I said, do this video to touch bases on that bleeding, you know, especially if you're doing medicated cycles. If you start, you know, just take a test the next day just to make sure, you know, just to make sure, because if I hadn't done that, if I had just listened and I thought that, you know, that my levels was going to be at 0 and I would have started another set of injections that Monday, you know, because I would have just assumed that I'm on cycle day 3 of my period, you know, and I would have started another cycle not even knowing, you know, what was going on really inside of my body, because I was bleeding. It was not, you know, they kept saying, well, is it spotting? Is it spotting? I'm like, no, it's not spotting. I mean, no, it's not as heavy as my regular flow, but it's definitely not spotting. I was definitely using pads. And my HCG was clearly going up, you know. So it's just, I mean, if you're on, you know, so even if you're not, and you know, been trying, and you know, you start, you know, or you think you start, maybe just like that next day, just make sure that you ain't getting a squinter, because that is exactly what happened to me. And that squinter turned into, you know, my HCG getting up, it being ectopic, and, you know, this whole ordeal. So that's where I'm at with everything. If you're trying to conceive, I'm wishing you nothing but the best. If you have any questions about, you know, anything that I've personally experienced, then, you know, you can just let me know in the comment section, and I'll, you know, try to answer. I don't have much videos up or much followers, so it will send an alert on my phone, and I'll know that, you know, somebody asked a question or something. But I just wanted to give you guys that quick update, and I will put another video up once I get into my next, you know, my next cycle and everything, because I go back to the doctor in 2 weeks instead of, I've been going every few days and then every week. Now that it's at 9, they said to come back in 2 weeks. So that's when I'll know a little bit more information about what my body's doing. So thank you for listening, and good luck, everybody. Bye.